A birth control pill will soon be available in stores without a prescription. That's because on Thursday, the FDA approved the oral contraceptive, the O pill, for over-the-counter sales. Joining us now in studio to talk about this monumental change and this approval for women and what this means for women nationwide is Dr. Taylor Stanton with the Henry Ford Health System. Thank you for being here with us.
Thanks for having me.
Yeah, so this is a big change. What exactly does this mean for women when it comes to being able to have access to this?
I mean, this is huge. So there are a couple of options for over-the-counter birth control now, mostly with like condoms, emergency contraception. And this would be something that is so much more effective for birth control. It's very, very safe, and people are going to be hopefully able to get this even without a prescription. They won't have to go to the doctor's office, won't have to, be on wait lists to see doctors to, get the refills and things like that. So this could be a huge game changer for access.
Okay, so we see one obviously big change is that quick access right there without the prescriptions.
Yeah.
What are some of the other ways that this is different from some of the other options?
So the other options, they don't work as effectively. So the ways that these birth controls work with the progesterone-only pills, they are effectively helping to block up the cervix so sperm can't get in, and that's way different than the ways that condoms, emergency contraception work. This is something that if people are taking it, every single day, this is, I think, in the high 90s for, effectiveness. That's really going to be a game changer for people for being able to take control of their bodily autonomy.
So for women who are obviously concerned about safety, what are your thoughts on that?
This is great because the type of hormone that it has in it virtually has no people who can't take it unless you have breast cancer or have ever had breast cancer. So this is incredibly safe for so many people. There are some, warnings that will come on the box for people to, if they're pregnant, then they shouldn't be taking it either. But it's just something that is not going to have bad side effects for almost anybody who takes it.
Wow. So what do you think has taken so long for us to see something like this?
Such a good question. I mean, reproductive health gets very highly politicized, and sometimes it's really hard to move things through, state houses or through Congress to get these wider-reaching approvals. So I don't really know why it has taken so long for this to happen, but we have all the safety and efficacy data for so many years that it just was the right timing with the right FDA.
Okay. Do you think that this is something, like you said, it gets a lot of backlash? Do you think that this is something that will still have a lot of people not the most happy about it?
I'm sure, because it has to do with just reproductive access, reproductive justice. But what I think from a medical standpoint is that we're really excited for something that we know is really safe and really effective for people, that hopefully is going to be, some people can decide on their own whether they want to take it or not, and not have to have other people telling them whether they can or not.
Now, in terms of access, would you say that this is an expensive option, or is this something that will...
It's hard to say right now. So the manufacturer is going to be setting the price and is going to be saying when this is actually available. So we don't actually know when it's going to be hitting the shelves. But states or federal laws could help protect the cost of these. It may or may not be available with a prescription. There may be cost covering with a federal mandate. Those things all remain to be seen, but it would be a really important thing for this to be actually accessible for people if it is, affordable for them as well.
Sure, so we'll have to wait and see.
Yep.
Any side effects?
There are, with these hormones, there can be some side effects. It's a pretty small dose, but some people can have headaches, some breast tenderness, and irregular spotting. But thankfully, it doesn't have very big health consequences.
Okay, now when you are taking this, is there something that you need to know just in terms of maybe mixing medications or just eating it with food, having it with food?
Great question. This is, from what I understand from reading the label, it appears that you take it just about the same time every day. There are certain medications that can alter how effective it is. They're on the box. I want to say it's, St. John's wort, some HIV medications, some of the seizure medications. Some of those can affect efficacy, but thankfully those are going to be right on the label.
Okay, and then if there are any women who are wondering if this is a good option for them, what do you say to them?
Oh my gosh, well, if you want to come talk to your doctor about it, we're going to be super happy to. If you are someone who doesn't have a doctor, you can hopefully go online and read some of the articles about this and see what the FDA's approval is looking like. But please come to your doctor, make an appointment with your OB/GYN or your family medicine, internal medicine. We'd be super happy to talk about how to use this.
All right, Dr. Stanton, thank you for your insight.
Thank you.
We appreciate it.